Hi everyone, I wanted to do a quick video on CPAP setup. I've had a couple people approach me over the last few weeks saying that they did a good job. They were able to identify that the patient was a candidate for CPAP, but they kind of fumbled through actually setting up the CPAP. So this video is just going to be a quick down and dirty on how to actually set up the CPAP. I want to remind you that we have two separate sizes of CPAP, okay? We have the large adult and the medium small adult. The only real difference between the two is the mask size. And so you're going to have to use your best judgment to figure out what size mask is going to be best for the patient, okay? You can see here they're just slightly different. So once you determine that the patient meets the indications for CPAP and doesn't meet any of the contraindications, then we can go ahead and start setting this up. Oftentimes you should be doing that at the same time. The partner could be getting a set of vitals while you actually start setting up the CPAP and talking the patient through this procedure. Remember, you're trying to sell this procedure to them. So in the package, you should have the mask here. Oftentimes these all come separately, right, or not already set up, and I think that's probably where the confusion comes up. You should have your tubing, and here's the nebulizer, and the manometer should be up here. Please make sure that this dial is on the off position, okay? So the on position is on the side, and that starts the nebulizer. We don't want to start with that yet. We want to go ahead and keep that in the off position. I want to remind you that you don't have to put albuterol on this first before you actually put it on the patient. Let's get this administered to the patient first, and then we can start putting albuterol or other treatments involved, okay? So it's very simple. This pretty much just comes right in place. I want you to be careful with the nebulizer piece because that will easily fall out, so make sure that is nice and set up. Hey guys, one thing I forgot to mention, don't forget the HEPA filter. This extra tubing here on the side goes right underneath the nebulizer, and that's so that way the air can bypass through here and go through the nebulizer. Oftentimes what I like to do is connect all sides, so there's two connections, one on this side and one on that side. Disconnect one side and put this right up to the patient's face. Oftentimes you can also have them help you with that process. Once they kind of feel comfortable and you understand it, or you believe that they're going to be able to keep it on, then we can slide this netting behind them, make sure it's nice and snug behind them. You can clip it in place, and then if it needs to be snugged down more, these are Velcro pieces here. You can just unvelcro them, pull them tight, and you should be good to go. Oftentimes the biggest complaint that patients have is that they have too much air coming through the nose piece here and it's drying out their eyes. You can alleviate that by using this adjustment right here. All you have to do is pinch these two plastic pieces together, and when you do that, you can move this forehead piece up and down. Hopefully that helps. If you have any other questions, don't hesitate to reach out.